today's talk is for Toronto Climate Week, and our hope and our aim was to invite people in from outside the Collaborative Center. And today we're really going to be exploring, in an introductory way, our health in a changing climate. So I'll start us off with a land acknowledgement. I wish to acknowledge this land on which we live, work, and play. For thousands of years, it has been the traditional land of the Wendat Nation, the Seneca, and the Mississaugas of the Credit. Today, this meeting place is still the home to many Indigenous people from across Turtle Island, and we are grateful to have the opportunity to work on this land. And this beautiful image is from nativeland.ca, which is a website you can go to and explore the Indigenous languages, treaties, and nations in your community. So a bit about the Collaborative Center. The Collaborative Center for Climate, Health, and Sustainable Care is a multi-faculty academic unit at the University of Toronto, leveraging the combined strengths of the Dalla Lana School of Public Health, the Temerty Faculty of Medicine, the Lawrence Bloomberg Faculty of Nursing, and the Leslie Dan Faculty of Pharmacy, the four founding faculties of the center. The Collaborative Center provides a dedicated academic home to advance climate change, sustainability, and planetary health research, education, and action for health and across health systems. And you can go to the website. That QR code will lead you to the most recent report on all of the activities of the center. In addition, you can come to our annual symposium, actually now called a conference, which will be happening on October 23rd. You can learn more at the first QR code there. You can review our professional development and faculty support resources, sign up for a newsletter, or become a member. And if it's too difficult to follow those QR codes right now, you can always get in touch at climate.health@utoronto.ca. All right, so let's dive into the topic at hand. We are here because climate change is a health crisis. The Lancet, the World Health Organization, and finally the Public Health Agency of Canada have all called climate change the biggest health threat of this century. And still today and this week in Toronto Climate Week, health has not been a topic of great discussion. It's not something that we hear about often in mainstream media, in mainstream conversations about climate change. Health is determined by more than just healthcare, more than what we do in our healthcare institutions, in our emergency departments, in our primary care clinics. Social and structural factors like income, housing, education, also things like racism, colonization, and economic inequality, those all determine more than half of someone's health. And these social and structural factors are underpinned by the ecological determinants of health. People need access to clean air, clean drinking water, a stable climate before any of the other things can really be addressed. And the health system itself is also dependent on a stable ecological system. The health system needs a stable supply chain, consistent access to clean water, clean air to operate a functional health system. Damaging the planet damages health, and it's not just climate change. Today, we're going to be focused on climate change, but also other harms to the natural world can also affect human health. Things like biodiversity loss and land degradation also have significant impacts on human health. And this image is from the original Lancet Commission on Planetary Health, which really coined the term and the movement back in 2015. But we'll turn our attention back to climate change since this is Toronto Climate Week, and climate change is the crisis that is most urgent. So how does climate change affect the health of people living in Canada? This map kind of illustrates the various impacts on the health of people living in Canada. It was published in 2019 by the Lancet, and I'm going to go through each of the impacts separately. So first of all, climate change results in more frequent heat waves, which particularly affect the elderly, young children, and those with chronic medical conditions. In Toronto, extreme heat days are expected to triple by 2050 from a 2005 baseline. And extreme heat poses the direct threat of heat-related illness, heat exhaustion, and heat stroke. And it also worsens chronic conditions like asthma, heart disease, diabetes, kidney disease, and mental health conditions, which we'll learn more about later. And, more than 600 people died in just 5 days in BC's heat dome event in 2021. That is not an anomaly. We will be seeing more events like that in the years to come. Climate change is also driving an increase in wildfires, which cause direct physical injury, significant mental health impacts, and then the poor air quality also exacerbates respiratory conditions. It can trigger heart attacks and strokes. It can worsen diabetes control. It increases the risk of poor pregnancy outcomes like low birth weight. And repeated exposure, there's emerging research showing that it can have an impact on neurologic conditions like dementia and childhood developmental conditions like ADHD. Cyclones, tropical storms, floods also have an impact on by causing physical injury, mental health impacts, also lack of access to water and sanitation and healthcare services. We saw this multiple times. There was the case of the town of Merritt, BC, which was completely cut off by flooding from other communities, and they lost access to medications. Medications actually had to be helicoptered in to supply people who had chronic conditions. Changing weather patterns and increased heat also leads to a change in vector-borne disease. And here in Canada, what we see most is an increase in Lyme disease, especially here right in downtown Toronto. And then globally, there is an increase in mosquito-borne illness like malaria, West Nile virus, dengue, and Zika. With milder winters, we see an extension of the allergy season and an increase in allergy-related illness as well. And then finally, the biggest two health impacts of climate change are indirect. The changing climate leads to displacement, which of course has a huge impact on mental, physical health, and also access to the necessities of life and access to healthcare. There are examples from the global south, Bangladesh, Syria, for example, but migration is not just limited to the global south. In the summer of 2024, the entire town of Yellowknife was evacuated for several weeks as a result of wildfires, and that caused disruption in access to healthcare, for example. And then finally, undernutrition is projected to be the #1 health impact of climate change globally. And we're already seeing changes in access to wild foods for Indigenous communities. And then globally, there's been quite a significant increase in the share of population reporting moderate to severe food insecurity. And this is from the 2025 Lancet Countdown on Health and Climate Change. Burning fossil fuels causes more than just climate change. In addition to, it also causes significant amount of air pollution, which has been shown and linked to many kinds of lung and heart disease, but also other conditions like dementia, diabetes, kidney disease, and mental health impacts. And a 2021 study found that air pollution is responsible for 1 in 5 deaths worldwide and 1 in 7 premature deaths here in Canada. And so tackling climate change will also reduce these harms. This photo represents a patient of mine who I often think about because the health effects of climate change are not felt equally. And those who are already most vulnerable and marginalized are most affected. Indigenous people, racialized people, people living in poverty, for example. So this patient of mine, he has asthma, he's elderly, and he lives alone in a tower in St. Jamestown. And, I worry about him being isolated on an extremely hot day and suffering an asthma exacerbation, for example. So it's not all bad news. Tackling climate change has also been called the biggest opportunity for health of the 21st century. First of all, tackling climate change will reduce illness associated with the climate disasters that I've just described, but also the decrease in air pollution will lead to an immediate improvement in air pollution-related illness. And then finally, many of the solutions we need to tackle the climate crisis will also have additional benefits for health. For example, we know that active transportation reduces heart disease, diabetes, and improves mental health. And transportation causes about 1/3 of Canada's greenhouse gas emissions. Increasing access to plant-rich diets improves cardiovascular health, reduces the risk of some cancers, and also agriculture is responsible for 13% of greenhouse gas emissions globally. So we can reduce emissions and we can improve human health. Increasing access to urban green spaces will directly reduce temperature by reducing the urban heat island effect and also improves well-being. We know that access to natural spaces, green spaces, improves mood and concentration, reduces depression symptoms, and improves sleep, for example. And then finally, we know that meeting the target, this has been modeled, meeting the targets of the Paris Climate Agreement would save over 1 million lives a year from air pollution alone by 2050. And as an example, right here in Ontario, the ban on coal-fired power plants has seen a very significant reduction in air pollution and a reduction in smog days from a high of 53 in 2005 to none since the last coal-fired power plant closed in 2014. All right. So now I'm going to turn it over to Stephanie, and Stephanie's going to talk a little bit about health impacts on older people. Stephanie is a scientist in the Women's Age Lab at Women's College Hospital and an assistant professor in the Dalla Lana School of Public Health at the University of Toronto. As a community-based researcher and critical gerontologist, she is leading the development of a national collaborative focused on equitable and sustainable strategies to support older adults in a changing climate. Her research addresses systemic barriers and evaluates community-based interventions to improve quality of life and advance health equity.
Thanks so much, Samantha. I really appreciate it and appreciate the invitation to be here to talk to you about something I'm very passionate about, and the hope is to make people more aware, more passionate about it. So Samantha really talked us through, a little bit more about the human health impacts with regards to either planetary health or climate change. And yet my focus and what I'm really interested in is why older adults tend to be often either overlooked in climate research policy and adaptation planning, and thinking about how the omission is very and quite concerning considering Canada's rapidly aging population. So approximately about 19%, if you didn't know this, fun fact, of Canadians are now age 65 years and older. And actually adults age 85 and over represent one of the fastest growing segments of our population. And so I'm not a demographer and I'm not alarmist. However, these are challenges and opportunities that we have for our research and our policies. And so another kind of coinciding challenge and opportunity with this is that most people, most older adults, wish to remain in their homes as long as possible and in their communities as they get older. And so part of that, and thinking especially about Toronto Climate Week, almost 70% of older adults live in cities, right? So that figure has actually risen about 20% in just about 5 years. So thinking about this, more than 80% of Canadians, over 65 want to what we call age in place, right? Stay in their communities as long as possible. And research shows that that's actually quite important for social connectedness, dignity, and overall well-being, as well as our health. But over the next 2 decades, what we do know is that older Canadians are expected to grow substantially, right? Talked about the projections, the fastest growing segment of population, 85 plus, but that is actually projected to nearly triple by 2046, right? So these trends really intersect with a changing climate in several ways, in several important ways. And really is that older adults are disproportionately susceptible to climate-related hazards. Like Samantha mentioned, we talked about extreme heat, poor air quality, flooding, disruptions to essential services, and a lot of people aging in those urban environments, in those cities where those climate risks are amplified, right? Looking at urban heat island effects, housing conditions, different, limited mobility. And so as these climate-related events kind of become more frequent and more severe, we need to make sure that our communities are livable, that they're safe, and of course, supportive to, and critical to our growing population. So I'm not going to spend too much time on this because I think Samantha really highlighted it, but older adults really face what we call these triple threats in the context of a changing climate. And so first, aging is associated from a biological perspective with more physiological changes, right? So these reduce our body's ability to thermoregulate and adapt to extreme temperatures. Sometimes that includes challenges that are compounded with chronic health conditions or different medication use. Second, you have these biological susceptibilities, which intersect with different social and structural factors, right? So that could be limited mobility, chronic disease, and reduced access, of course, to support networks, right? So these consequences and kind of these intersecting risks were really evident during the 2021 British Columbia heat dome, right? So, Samantha, you mentioned that I think 619 people died during that heat dome. And what we do know from that when we looked back is that about 67% of those people were actually 70 years of age and older. And a lot of them lived alone, right? So there's a lot of factors, whether that be older adults, living on fixed incomes or facing housing challenges, these all could result to a certain degree to this compounding burden, right, of climate impacts and the disproportionate risk that older adults face in this climate. And one thing I always say, and I will, if you take anything from my spiel here, is that we're all aging. If you're lucky, you will be old one day. So it's quite important that we place an emphasis here. And so what are we kind of trying to do with this? So, Canada's really at this intersection of two defining demographic and kind of societal transformations, right? So we have this rapidly aging population, and then we have this accelerating climate crisis. So addressing these kind of interconnected challenges really requires this national response. And so myself and a community partner and a person with lived experience, we formed the governance structure of a national collaborative on climate change and aging. And so what we do is we bring together researchers, we bring together healthcare leaders, policymakers, community organizations, and older adults themselves to kind of bridge the gap. So what we're hoping to do, we actually just wrapped up two World Cafe events. We have another one coming up at the end of the month to talk about priority areas for impact and change. And so, decisions being made today about climate adaptation, housing, health systems, preparedness will shape the health and safety and well-being of older Canadians for the decades to come. And the last thing I'll say is, we talk about health equity a lot, and oftentimes people assume that it stops at 65. So I would urge people to think about health equity beyond that point in our age. So thank you so much.
Thank you, Stephanie. I'm now going to turn it over to Siki. Siki is an academic psychiatrist at the Center for Addictions and Mental Health. She completed her medical and psychiatry residency training at the University of Toronto and a Master of Science degree in global mental health at the London School of Hygiene and Tropical Medicine and King's College London. As a Royal College of Physicians and Surgeons of Canada Detweiler Fellow. She has a special interest in transcultural psychiatry, global health equity, and psychosocial responses and interventions in the context of climate change. She has served as a global research and action agenda expert working group member of Connecting Climate Minds and contributed to the collection of work Climate Change Across the Life course commissioned by the World Health Organization. Thank you, Siki.
Thank you, Samantha, for the introduction, and hi, everyone. It's really a pleasure to be here to speak to you about the intersection of climate change, mental health, and our psychiatric care system. So the field of climate change and mental health has really grown exponentially over the past just several years and gained increasing international attention. So in 2022, this was the first time ever that the World Health Organization has released its first policy brief highlighting this historically under-recognized field. And most recently, the Lancet Psychiatry, which is a world-leading scientific and psychiatric journal, has announced a new commission that involves over 100 scientists and people with lived experience of mental health conditions to really synthesize what we know about the impact of climate change and extreme weather events on mental health, and to form recommendations on how we can best address these consequences and how we can better build psychological resilience in this changing world. So when we zoom in from this global movement to country-specific actions, we can see from this diagram on the right-hand side that out of the available national adaptation plans or NAPs out there related to climate change, just about under half of them specifically recognize mental and psychosocial health as being climate sensitive. So relatively speaking, in comparison to vector-borne diseases, waterborne diseases, malnutrition, food insecurity, and respiratory diseases, which are also very important to our general health, mental health relatively has received less attention, but this is definitely changing. And when we think about how exactly mental health impacts, triggers down to our individual mental health, emotional well-being, I'd like to refer to this diagram that's done by Dr. Lawrence and colleagues from Imperial College London. So when we see the top of the diagram, we see these climate change factors, whether it's acute weather events, more chronic weather events such as droughts, as well as gradual global changes such as global warming and sea level rise. There would be both direct and indirect impacts on the communities in which we live in. So directly speaking, there would be potentially loss and damage of our homes and properties, as well as crop and livestock damages if you're in a farming community, and a loss of habitats for indigenous peoples. And our health systems, as Samantha mentioned, can be disrupted as well when people have troubles filling their prescription medications or attending appointments. And indirectly speaking, there can be our collective witnessing of changes to homelands or lands belonging to our ancestral people or people living elsewhere in other countries, if you're from an immigrant background, and in general learning about climate and ecological impacts from social media and from news outlets. So as an individual, you can experience increased anxiety or depression symptoms, or develop new cases of post-traumatic disorder or PTSD, for example. And we have data to show that climate change and extreme weather events are very much linked to increased suicidal thoughts and increased suicidal behaviors and increased death by suicide. On the other side of the spectrum, we see less clinical impacts of what we call climate and emotional distress, and that can manifest as climate anxiety, ecological grief, climate distress, or in general, a sense of anger and hopelessness and frustration that may not reach the clinical or level of requiring psychiatric intervention, but still very much impact on people's quality of life. And importantly, climate change is also related to increased susceptibility to physical ill health and death of those with pre-existing psychiatric conditions and schizophrenia. So that's also an area of great interest in this intersection space that I'll be happy to speak more about later.
Thank you. All right. So finally, we have Kate Hanneman, who will be presenting, and then we're going to have a great amount of time for discussion, which is what we hoped for. Excellent. So Kate is a cardiac radiologist at the Joint Department of Medical Imaging at the University Health Network and Vice Chair of Research in the Department of Medical Imaging at the University of Toronto. She leads an active research program focused on environmental sustainability and improving health outcomes for patients using cardiac imaging.
Thanks so much. And it's really wonderful to be here today and also to follow these great talks. As we've heard, there's many impacts of climate change on human health through different exposures and also on different parts of our bodies and organ systems and mental health. And in my role as a cardiac imager, a lot of my research is focused on the impact of climate change and the downstream effects on cardiovascular health and specifically the heart. And I think it's really important to recognize that climate change isn't a future problem. It's not a problem for someone else that lives somewhere else in the world or even somewhere else in the country. But as we heard from a few people already, it is also important to recognize that how we experience this differs from one person to the other. And I like to think about this differences in our vulnerability in three big groups. So how we experience each exposure, depending on where we live. For example, if you live in the interior of BC, you're going to have higher exposure to wildfire smoke, for example. And if you live in Toronto, you will experience more extreme heat events than if you live in northern Alberta. So that matters. It matters what job you have. If you do physical labor outside, for example, of course, you will have more environmental exposures. Then there's adaptive capacity. This is kind of the things we have at our disposal to potentially help us. If you have access to air conditioning, for example, you are at lower risk of extreme heat events and stress on your heart. And then susceptibility, this kind of refers to our underlying biological processes or what's going on in our body. And we heard a lot about older patients being vulnerable, and that's certainly true for cardiovascular health as well. But even patients who have other disease processes already, if you have heart disease already or diabetes, for example, you're at higher risk of experiencing something bad related to an environmental exposure. And so all of these, again, contribute to vulnerability, and that's important to recognize in this context. And when we think about climate change and the impact on cardiovascular health, it really can impact our health across a number of outcomes: increased frequency of heart attacks, stroke, heart failure, people coming in feeling short of breath to the emergency department or to their family doctors, arrhythmias where your heart is not beating normally, and even death from heart disease are all increased in the context of a changing climate related to heat and other exposures that we've talked about. At the same time, I think it's really important that we talk about the impact on health systems and our ability to meet these increasing health demands and deliver that care in a sustainable way. So very briefly, I just want to spend a few minutes zooming in a little bit on the impacts of air pollution on the heart. So as we heard, when we burn fossil fuels, not only do we increase greenhouse gases, we also emit air pollutants. And I'm really going to focus here some of my research related to fine particulate air pollution, which we can have increased exposure to related to wildfire smoke. So very closely related or very related to climate change. And here the image on the left is CT images. So this is what I do in my day-to-day job, where we can take pictures inside the body to try to understand what's happening. And the patient at the top had much higher exposure to air pollution over many years. This was a 10-year average, and they have a lot more calcium in their heart, which is an indication of plaque or buildup, and that can lead to heart attacks eventually. There are many reasons for that, other contributing factors such as smoking, for example, but we now know that air pollution is one of the risk factors that can increase this buildup of plaque in the heart. The image on the right shows us a few images of hearts from cardiac MRI. So a different imaging technique, and here we're really focused on what's happening in the muscle of the heart, which beats, of course, every time we have a heartbeat and is really important. And we also now know, based on imaging, that patients who have more air pollution exposure can have more scarring in their heart, and that can impair the ability of the heart to beat normally. Then heat and changes in temperature, which happen not only on a kind of average scale when we're thinking about global trends, but we can have increased frequency of extreme heat events related to climate change, can impact the number of patients coming to the emergency department and also the demand for health services. So here, this is just showing that temperature increases, even a few degrees, can significantly increase the number of imaging studies in the emergency department. This is mostly related to more patients coming into our emergency departments. So very important for us as health professionals to be prepared on very high heat days in the summer, and for patients to potentially understand that there may be longer wait times, and we really need to be able to meet those demands. At the same time, that's kind of on a very short scale, a couple of days. We also know that in our changing climate, as we have global warming, this impact can be actually projected out into the future. And the increase in healthcare demand will really depend on climate projections. And so depending on what pathway we follow, the climate scenario, again, these are all projection based, we may have higher demands on our health system here at imaging-based projections. So with that, I'll pause, and I'm happy to answer any questions about this in our discussion. Thank you.
Thank you, Kate. All right. So we're happy to take questions from the audience. But while we wait for those questions, I'll start us off. So in your recent clinical or research work, what climate-related health changes have you observed that surprised you? Maybe I'll start with Siki.
I would say so. Recently, I actually completed a series of interviews with patients who require psychiatric care at my hospital in terms of how climate change can be affecting their mental health and their lives. So I think the change that witness is that even though patients are experiencing potential side effects from their psychiatric medications, they feel that they haven't been able to receive that information directly from their clinicians. So in that sense, because we want to fill that need, the hospital is now producing more training materials for the clinicians such that the counseling for the psychiatric medications can be more proactive. So in a way, it's a positive change. I think on the other hand, I still find that patients are not very much actively coming to the psychiatric clinics and talking about their distress related to climate change. And I asked the patients who are part of the interviews why that may be, and the patients essentially relate to me that they're not sure whether a doctor's room is inappropriate for it, or they worry how they may be perceived by their doctors, especially if climate change is an increasingly politicized topic. So in that sense, the change that we are hoping to implement is to also increase provider awareness, such that we can have more open dialogues about things that may be very much tangibly affecting our patients, but that they may shy away from discussing.
Thanks. Kate or Stephanie, do you have anything to add? And Brittany, maybe can you pin us all?
I might oh, go ahead, Kate.
Sorry, I didn't mean to talk over you. I'll just speak really briefly. I just wanted to say, the thing that surprised me was how widespread the impacts are across the body, learning about the impacts on mental health and different organ systems. And, that really, I think sometimes is a bit of a misperception where people think, air pollution impacts people who have asthma or COPD, but really impacts a lot of our health systems. And so I think that's really important to recognize.
And maybe just to briefly add, I was recently in Vancouver for one of the World Cafe events that we were hosting, and I was talking to a person who had lived in her community for about 25 years, and she said something that really stood out. And, speaking to this question about climate-related health impacts, she said, I live in this high-rise building. I've been in here for 25 years, and it's the first year I can't open my screen door, and I live on the 7th or 8th floor. For various reasons, but also because one, allergies, but also there's this new kind of moss that's growing apparently in and on their balconies, and that apparently, this person is very susceptible to. And so, those small, smaller pieces like that we don't necessarily see or maybe not hear about all that often, but, lead to then the isolation or, not getting appropriate, resources that you might need. So all to say is that story really kind of stood out to me.
Yeah, that's very interesting. I would say as well, in my family practice, it's so hard to know whether climate change is actually like an upstream cause of the presentation that I'm seeing. So it's hard sometimes but you need to pair the data with the stories in order to really figure that out. There are a few cases where it's like very clear, like I had a patient last summer with a very severe heat rash that then developed into extensive cellulitis. And that was like a clear link to heat, but it's not always so clear. I see a question in the chat. What policy asks should we prioritize in our advocacy work around climate and health? Maybe Stephanie, do you want to start us up?
I'll just start us up. I think my piece de la resistance is very, aging. Like I think older adults need to be placed as a priority area. I think we've done a lot of work in the space around naturally occurring and community-based work, but naturally occurring retirement communities, which we call them. You may have heard NORCs. And so, I think we need to figure out policy, adaptation policies, emergency preparedness, but not just that, like beyond emergency preparedness, because I also feel like we don't just need to adapt, or prepare, we need to figure out well in advance what these kind of earlier impacts, what these later impacts are, what the earlier kind of interventions are. So older adults, that's my priority area for sure.
Siki or Kate, do you have anything to add?
Yeah, I'd like to add that maybe from a psychiatrist perspective, my priority is people with pre-existing mental health conditions. And I do think that based on my slide earlier, mental health hasn't been globally recognized as a climate sensitive area. And I do hope that policymakers can increasingly understand that it's very much a relevant issue, and it should be incorporated into the adaptation plans, both in terms of preventing new psychiatric conditions and their onsets, as well as supporting people who already have their chronic mental health conditions. And yeah, I'll pause here.
I'll chime in very briefly just to say that I think we need mitigation at the same time of adaptation and resilience. And so it's very clear that there are different potential future scenarios, and while the health effects are here and now of climate change, they could potentially get much, much worse. And so I think decreasing greenhouse gases and ensuring that we are in a more favorable future climate scenario is really important. We need to think about that at the same time that we're thinking about adaptation and resilience.
And I have something to add. It's not quite an answer. The question was, what policy asks should we prioritize around climate and health? I would say that all policy asks should be framed as climate and health. Climate equals health. When we frame climate change as a health issue, there are lots of studies that show people are more likely to pay attention. People are more likely to support mitigation policies, greenhouse gas reduction policies. Even, in the United States, there was a study of thousands of people, and even Republicans support climate action when you frame it as a health issue. So that's my sort of sideways answer to that question. The next question that I see in the chat is for Kate. How can cities prepare or adapt for the increased demand to healthcare services as climate change continues to worsen? Or continues or worsens. Do you have an example of a Canadian city which has taken action in this way already?
I love this question. It's forward thinking, and I often think about our response to climate health effects and increased demand at the kind of level of the health institution. So I might frame my answer in that regard. And we've done a lot of work in terms of modeling short-term impacts, and I think this is really important that we take these changing climate and, of course, kind of weather and based productions into consideration when we're thinking about workforce planning. So not only physicians, but of course, all of our frontline staff, nurses and technologists for image acquisition and so forth. So that's really important. And certainly there are many hospitals that are working and recognizing this. I don't know anyone that is kind of taking short-term environmental projections and perhaps changing their workforce schedules, but we might get there. And from a city perspective, because I think this is also really relevant, thinking many cities, of course, hopefully all of them have climate and environmental policies, including the city of Toronto. Sorry, I have my academic hat on today, apparently. And I think thinking about how we ensure we have an adequate workforce to meet these demands, we have ways for patients to get to hospitals. So emergency medical services, that patients aren't waiting a long time for after they call 911, for example, and have access even on roads if we're talking about an extreme weather event. So lots of preparedness needs to go into this at multiple levels, municipal and healthcare. And certainly there are many cities that are doing this work.
Can I maybe just add briefly to that? Because I truthfully believe in the power of cities and municipalities for creating effective change, especially for something that is so, that crosses, like Samantha said, about the boundaries of health and wellness, is with climate change. And maybe just a concrete example too, Kate, to further your point as well, the city of Westminster in BC actually created a bylaw that requires landlords to have a minimum temperature, internal temperature of 26 degrees or lower in at least one room of a rental unit. So those are, kind of concrete actions that can be taken by cities, by municipalities to make sure that effectively addresses these kind of issues.
Yes, and a bylaw was brought forward this year at Toronto City Council, but it has been postponed indefinitely, unfortunately. So write to your city councillor that we need to be adapting and protecting the most vulnerable renters so that they don't end up needing access to healthcare, so they have access to cooling. Okay, we'll get to another question. Beyond adaptation and resilience, do you see any big role or levers for change for clinicians and healthcare practitioners in advancing upstream preventative action and mitigation? Do any of you have something?
I can chime in really briefly. I think the single most important thing for healthcare providers across the board is education, talking about it, and linking our changing climate with human health. So as we said, this has to be fundamental to the conversation. It's not abstract. It's not just greenhouse gases. It's impacting our health. And so I think as health providers, we are a trusted voice in that regard. And so making sure that that is communicated loudly and frequently, that will put a lot of pressure, for lack of a better word, on some of those levers.
Yeah, and just to add to that, related to education, I think something upstream is about the education of the future generation of clinicians and providers as well. So from a mental health perspective, I think it's very encouraging that the Canadian, the UK, the European, and American psychiatric associations have all issued, for example, policy statements or where they stand in terms of climate change and mental health. And really, these statements are trickling down to the curriculum design of undergraduate students, medical students, and residents. So I think as more clinicians are more aware, and they can more readily tackle these conversations in the public sphere as well, linking climate and health, as Kate mentioned.
And I'll add, I think that as frontline clinicians and researchers, something that we are very privileged that we have frontline stories that we can tell about patients who have been affected by the climate crisis already. And so we can leverage our trusted voices and tell those stories and very effectively link climate change to health again and again and again with policymakers and in the media so that it really truly is seen as a health issue and we can leverage those narratives. Okay, I will go to another question. Let's see. For Siki, where would you suggest people with climate concerns that are affecting their mental health seek help?
I think that's a really good question. Right now, in terms of interventions, a lot of the interventions are very grassroots initiatives, whether they're happening on campus or happening because a passionate person started non-governmental organizations. So a really good example of that is a climate cafe that and its model has been replicated across the world. So that I would say it's a very low threshold and thankfully free space for people with climate related emotions to connect with other people and to think about collective action. And I do think that it's still if you already have a trusted clinician that you're connected to, whether it's your family doctor, a therapist, or a psychiatrist, increasingly, I hope that they will be more welcoming of these conversations as well, especially if you think that there's an interplay with these emotions with your pre-existing mental health conditions, for example.
Maybe just to add, not obviously the clinical kind of healthcare provider approach, but even for a more community-based support. I think often people assume that climate change is something that not many people worry about, but those numbers are actually, the sentiment is actually incorrect. I think it's something like 70 to 80% across public. It's a bipartisan issue kind of thing. It's, most people do worry about the impacts of climate change. And so to say there's community organizations, there's groups. I know Toronto has the neighborhood climate, I think, group. I know there's a lot more, let's say, older adult focused ones like Seniors for Climate Action, Seniors in Leadership for Climate Preparedness. And, I think sometimes it's always helpful to just commiserate as well and to be able to be in and amongst people who share the same worries and same concerns and same even having that kind of shoulder to a certain degree to lean on in those moments of even grief. So all to say, of course, healthcare provider and, seek the appropriate support, but there's also those smaller organizations that might be helpful to look into.
There's so many questions in the chat, so I'm not getting to all of them, but is action towards mitigating health impacts of climate change the responsibility of the federal government, provincial government, or do individuals have any ability to protect themselves and prevent or reduce impacts? Kate, do you want to start us off? Yes.
I love it. This is such a great question. And I think, from my perspective, the answer is we need it all. And I think we can take a lesson maybe from our response to air pollution over the past couple decades. So we know that a government policy level response was critical to improving air pollution levels quite dramatically over the past few decades, by requiring that corporations implemented policies to decrease emission of air pollutants at the source. So, that's one example. But we know that individuals can take many steps to also decrease their exposure. So, not going and running a marathon on a day when we have wildfire smoke in the city, as an extreme example. Maybe not, also running a marathon on a day when it's very hot, for example. And so those are individual actions. But I think this is a nice example of how across the continuum from government policy, high level to individual choices, we all can make decisions that have a positive impact. And I do really want to empower everyone on the call, particularly individuals who are not healthcare providers, that, they can make choices in their own lives, not only to seek care when appropriate, but also to minimize their exposure.
And I'd add, of course, this is an issue that must be addressed at the government level also. And when we're feeling powerless, when government isn't acting, we can act in community, because sometimes it's not going to be as an individual that we can make the biggest change, because it's the most vulnerable and marginalized who are most affected. Elderly, isolated seniors, for example. So we can get together in our neighborhoods and think through ways that we can protect people who are most affected by heat and by wildfire smoke, for example.
And also add there too, because I think I spoke briefly about community organizations, and there's multiple lovely organizations here in Toronto, including Cruise. And I know, Samantha, you work with them really closely. And, they're a group that's really focused on building out emergency preparedness materials, and advocating for those in their own communities. I always say the key is really being a community-minded global citizen, right? So being the locus of control to a certain degree, for what happens, let's say in the UK, is maybe a bit out of your periphery, but to a certain degree, what you can do in your neighborhoods and your communities, you can make a concrete difference. Always not to place all the responsibility on the individual, like Samantha said and Kate said, we do have our governments who need to be held responsible. But at the same time, being able to be a floor captain, if you live in a high rise, to be that person or point person to, think about the neighbor who, like Samantha said, maybe is a bit older, has maybe some mobility challenges, maybe checking in on them during extreme heat events, is always a really helpful tool as well.
Thank you. Okay, let's see from the chat here. What role can organizations like Canadian Association of Physicians for the Environment play when it comes to increasing physician awareness, knowledge? But we could also address this with the Collaborative Center. What role could the Collaborative Center play? Any answers? Maybe Siki, do you have?
I think the fact that the Collaborative Center is organizing these events and have these open forums for discussion from multiple perspectives is already very helpful. I'd love to hear, Samantha, your perspective on the organization itself.
Sure. Yeah. I can speak about CAPE as the president of the board. We're working across the country. We're trying to leverage the physician voice, really to shift the narrative on what is the climate crisis and what is needed to tackle it, and the health benefits of tackling it. So that's what we're doing in multiple domains. We also have regional committees in every province who are working on provincial level issues, really using the same model for change. I think we've done some great work. For example, the closure of the coal-fired power plants, CAPE really was a huge part of that here in Ontario and also in Alberta. And then currently we are doing work on reducing the harms from gas power plants, for example.
I'll chime in really briefly. I think there's also a really important role for other professional organizations that aren't climate organizations per se to increase education and awareness, specifically of physicians and other healthcare providers who may not be following CAPE or may not be, following some of the climate organizations. And I have seen a lot of this, particularly over the past couple of years, where there's a lot more interest in kind of general healthcare professional organizations to increase awareness, not only through education. I think, funding mechanisms to support research on the health effects of climate change, and also opportunities to disseminate that in a way that's accessible, not just reading journal articles, but maybe webinars and so forth. So I think there's a couple avenues.
All right, I'm going to go to a question that we had actually asked ourselves, so not in the chat, because I think it's a good one. So what emerging solutions or interventions at the climate health intersection give you the most hope right now, and how can we accelerate these? Stephanie, can I ask you to start us out?
Obviously I'm not an older person yet, but I'm always inspired by the activists and advocacy of, different organizations and smaller organizations. I always think about, I'll shout out Carol Christopher. She is the director of SPEC. I believe I don't remember the full detail of the acronym, but it's around seniors advocating for environmental change. And, I think really honing in on those people and stories who are really leading the charge in really, making noise and shaking fists. And I feel like that is a particular piece that I'm very, very excited about.
I wanted to mention that so I recently did a scoping review to understand what kind of psychosocial interventions are really out there to support people's mental health in the context of climate change. And we found that surprisingly most of what the scientific community is used to is the aftermath, is that if the natural disaster hits, then there are interventions like psychotherapy to support the survivors or the victims who, for example, suffer from PTSD. Whereas what gives me the most hope and excitement is really, I think some of the our audience ask, is it the preventative interventions out there? So from a clinical perspective, what we are trying to do at our hospital is, I guess, to provide heat-based psychoeducation for people who are taking psychiatric medications, for example, so they know what precautions they can take in order to prevent heat-related illnesses and side effects while still continuing the treatments that are helpful for them. So I think it's exciting in the sense that it's education that can be delivered in a group setting, and people can connect with each other and have access to evidence-based information, while also have a sense of agency. But that is not to say that the interventions have to be in a clinical setting. I think, Samantha, in the opening remarks, you mentioned about these green space related interventions that really would take a multidisciplinary approach. So we know that these interventions are technically called co-benefit interventions, because the green spaces not only benefit the environment themselves, but also benefit the people who participate in them, or who even are involved in building them or creating them in the first place. And there could be a lot of positive mental health ramifications.
Kate?
Yeah, very briefly, I think one of the things that gives me hope is the recognition among healthcare providers, and even reflected in guidelines, that climate and environmental exposures are modifiable risk factors. So specifically in the context of cardiovascular health, but like we would think about a patient who has a smoking history or diabetes, for example, or family history of a father who died of a heart attack young, we think about their environmental exposures in a similar way. And I think the modifiable part of that is also really important, because that gives us hope that there is something we can do. Again, high level policy, but also at an individual level to decrease the risk and potentially identify it early.
That's great. Thank you. And I guess I'll just conclude by saying I'm hopeful that we have this opportunity to share the importance of the intersection of climate change and health with a wider audience, and we're hoping to do more of that. And I think there is a growing recognition in the public about the health impacts of climate change. I mean, it's so obvious, it's impossible to ignore. And so hopefully that means growing support for climate action as well. And I think we are at least seeing that at a municipal level at the moment, and hopefully we'll see more of that at regional, provincial, and national levels as well. All right. We have 4 minutes to go, so I guess we could turn back to the chat. If there are any questions that you see that you'd like to answer, Kate, Stephanie, or Siki, as we have 4 minutes to go. I thought we'd go to the end with that final question.
One thing that I saw a couple of people were asking about opportunities to get involved and research and maybe just directing people back towards the collaborative center, which has many opportunities, both academically, but also kind of a listing of people who are doing research and so forth. So I think that would be a really good resource.
Yeah, that's great. And for students, I know we wrote in the chat that there are lots of opportunities to get involved. And I see one final comment here. Do you see any opportunities for practitioners to increase collaboration on climate health projects with any key interest groups? Yeah, that's a great question. Stephanie, did you?
Yeah, I mean, I think there's a lot, like we said. I think part of the collaborative work that, I know Fiona Miller's here as well as the director here is like leading a lot of key groups. And I think Brittany put in the chat, there's for maybe not resources, but there's something running in later this summer with some details around a training for healthcare educational resources. All to say is there's always opportunities to think about. I think, the U of T Collaborative Center is one of them. I think any one of us on this panel here would be more than happy to receive kind of any kind of communication around if there's anything we know of, any kind of collaboration. We're always open to it. And maybe the second part of that question is anyone who's often missing from the conversation. I surprisingly always really struggle to really get a lot of federal representation in terms of policy makers. So I've been very, very lucky and very, successful with municipal and provincial, but I think federal representation is often a really hard group to tap on.
And I would also say just collaborating with community groups like CREW. There's not enough of that. Healthcare workers collaborating with community groups, collaborating with public health, for example. There's a lot of like silos that we are trying to break down at the Collaborative Center. And I think the four of us on the panel are also trying to break down in our work.